World Health Organization is the UN specialized agency for health-related subjects. As such, it is actually the lead partner for all health-related questions in Kenya. It is the strategic technical advisor to the Ministry of Health. So the World Health Organization office in Kenya supports the Ministry of Health in the implementation of its strategic and operational plans. WHO ensures basically the highest level of health through universal health coverage in Kenya.
The Triple Billion Target Initiative of WHO focuses on 3 key areas. 1. Achieving universal health coverage. 2. Protecting populations from emergencies. And 3. Promoting better health and well-being. In the context of UHC, the non-communicable and communicable diseases cluster focuses on 1. Non-communicable diseases, example diabetes and cancer, neglected tropical diseases like filariasis and schistosomiasis, communicable diseases like tuberculosis, malaria, HIV, immunization for vaccine-preventable diseases including polio eradication, public health and environment including climate change. The cluster supports the government in so many ways. We provide technical expertise and funding to the government of Kenya in developing and implementing policy documents, guidelines, and activities to address these conditions and diseases. We also support the government in identifying and assessing risk factors. We build capacity of health workers, we monitor and evaluate the outcomes of those activities, as well as the results and achievements, among others.
The emergency pillar focuses on emergency preparedness and response of outbreaks in order to ensure that we limit or avoid human suffering or loss of lives. In terms of emergency response, WHO provides the technical support as being one of the major technical experts. We also provide capacity building to Ministry of Health in situations of disease outbreaks. We lead in advocacy and resource mobilization in order to address outbreaks within the shortest time possible. The emergency pillar is always, for WHO, is always the first to respond in terms of provision of technical experts and also supporting the government in terms of preparing to respond to any disease outbreak. For the past few years, we have been involved in supporting the ministry in a number of disease outbreaks that were controlled within a respectable time as a result of the preparedness and surge capacity that the WHO continues to provide the government with. As we all know, that COVID pandemic has been with us for the past 3 years, and that has been a major outbreak that the WHO has been at the central pillar in terms of supporting the government and responding. We have also had a number of other outbreaks, including cholera outbreak, measles outbreak, and also dengue fever in some parts of the country. I think one of the greatest efforts is the COVID vaccinations, which came at a time when COVID was having a toll. And through the provision of support to the ministry in terms of rolling out COVID vaccinations, today we can see the numbers have significantly gone down, and we were able to limit the number of patients or clients who have been in hospitals as a result of the COVID vaccination rollout. Today, when you look at the world, every minute there's a new disease, and that kinds of makes us to be in a sort of a vicious circle. But one of the things WHO is prepared and currently undertaking is to ensure that we put in place a proper preparedness and response, so that when a new outbreak comes, it finds us prepared. When an outbreak comes, when we are prepared, you are a step ahead of the outbreak. But when the outbreak comes, when you are not prepared, the outbreak is ahead of you.
The way WHO works, usually have to be proud of the country achievements, because whatever the country achieves, we have contributed to, but also we be proud that the country has reached there. So in the area of universal health coverage and life costs, there has been very key fundamental achievements that Kenya has made over the years. And you could talk to issues like improving the density of core health workers, so meaning there are more workers available to provide services. There's more investment coming from the government, but also we have seen improvements in the service coverage and equity. One of the things I'm proud of that WHO Kenya is supporting the Ministry of Health is in developing the essential package of health services and linked to it the standard clinical guidelines, which are very critical in informing both the scope of the services provided, but also ensuring they are provided in a way that ensures quality. Linked also to our leadership role in the sector, we always convene, and even currently we are in the process of convening the sector again in ensuring that we lead the process of planning as a comprehensive sector plan and also ensure that it is monitored. So that is, it may sound routine, but is an achievement which we have to keep our eyes on for WHO to convene all the partners in that area.
More recently, WHO worked very closely with the government of Kenya in launching critical initiatives that some would call innovative initiatives, such as the setting up of a regional health emergency hub that will serve not only Kenya, but the rest of the region. The idea would be naturally to have a team of experts, emergency responders, stationed here in Kenya, a stockpile of essential supplies and equipment stocked in Kenya, and a training facility, simulation facility for emergency outbreaks, which would greatly benefit not only Kenya, but the rest of the continent. Similarly, a great initiative such as the creation of a regional center of excellence for assistive technology that would also benefit Kenya, but the rest of the region. The private sector is a critical component of development in any country. So it is fundamental that the private sector is brought into the overall effort of strengthening the health, improving the health of Kenyans. We've all seen the consequences of a health problem on the economy of a country. So the recent COVID-19 pandemic is a great illustration, is a great example of how a health problem can impact the economy, can affect the private sector. So this is an opportunity for us to extend a hand to private sector, invite private sector to join the pool of partners in supporting the Ministry of Health in its effort of ensuring universal health coverage in Kenya.